It's BoomerLife, lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is BoomerLife on CIL 650.
You made me so very happy. I'm so glad you came into my life.
Hey, and welcome to the show. I'm Zach Spencer. This is BoomerLife on CL 650. And today we're joined by the professionals at Integrative Naturopathic Medical Center. Could you come up with a longer name?
We could try, but it would be hard.
In studio, joining us is naturopathic physician Dr. Katie Leah and Kirsten McEwen, registered holistic nutritionist. Welcome to the show.
Thank you.
Now, Dr. Katie,
Yes.
Can you explain to me the difference? Because a lot of people are listening and they've maybe never gone to a naturopath versus a traditional doctor. What are the differences?
So some of the main differences between seeing a naturopathic doctor and a conventional physician. With naturopathic medicine, we're always focused on optimal wellness and preventative medicine. And a huge part of what we do actually focuses on diet, exercise, lifestyle modification as sort of the foundation to build on. That's why Kirsten and I always work so closely together. But in addition to that, we have options available for treating using things like herbal or botanical medicines, nutritional supplements. Most naturopaths do a lot of acupuncture and traditional Chinese medicine as a part of their practice. And then we usually have a hands-on structural practice. And then we have lots of other options available. Lots of naturopaths actually can prescribe medication. So, of course, there's always a time and a place for that. So we use it when it's appropriate.
So how does the education differ?
The education is a little bit different. The naturopathic programs are really focused on making sure that our anatomy and basic sciences are the same as a conventional medical school. But starting in about our second year, we start looking at different ways of treating. So a lot of the treatment modalities are primarily focused on more natural remedies, things that have less side effects. But the education process is certainly for the first 2 years very, very similar to conventional medicine.
And a lot of people go to a traditional medicine approach and they're not getting answers. Is that often who comes to you? It's like, I've been to the doctor, been to the specialist, gone for x-rays, MRI, and I'm getting nowhere. And then they say, I just want relief from whatever ails them, and they show up at your doorstep.
It's a really, really common story, actually. We see a lot of people who have, exhausted their options in terms of conventional medicine. The family doctor, the specialist, everybody says, well, everything comes back looking very normal.
But you don't feel normal.
But you don't feel normal.
Yeah.
And so, that's when people really start looking for other kind of complementary therapies. And a lot of times that's where we come in. I think in terms of the spectrum of wellness, where there's disease and pathology on one end. I mean, that's where conventional medicine really excels. But there's optimal on the other end. And a lot of people fall right somewhere in the middle.
And do you ever do it the other way around? Someone comes to see you and say, you should be going to see a traditional doctor for these reasons. Absolutely.
Yeah. We have, times where we refer back to the medical doctor, back to specialists. There are lots of times where there's something that is outside of our scope of practice in terms of being able to treat. But then there's a lot of things that, you can use conventional medicine and naturopathic medicine, and you can marry those two beautifully. And I think there's a time and a place for both. I think in terms of chronic disease and optimal wellness, naturopathic medicine really excels there. But for acute care management, I always tell people, look, if your appendix bursts or if you break your arm, don't come to see me.
Right.
Go to the hospital. Go do that first.
And sometimes I think you're probably dealing with the side effects of traditional medicine. So they may be in for something to see their conventional doctor, and they're on some kind of path, but there are side effects, and you can help counter that, I'm sure.
Absolutely,
right?
Yeah. There's lots of ways of, using conventional medicines and adding in, complementary therapies to offset side effects. We have a lot of people who also, they want to reduce the need for medication. So, my doctor says that, my cholesterol is getting high, or I'm at a high risk for diabetes. I don't want to go the medication route. What can I do now, in terms of my diet or nutritional supplements or exercise to make sure that I don't end up going down that path?
Well, that's a perfect segue for our holistic nutritionist, Kirsten McEwen. And when I first met you today, I said, Kirsten McEwen, that's a great name. And you said, I think you know my dad, right?
Yes.
And there's a principal at my son's, he used to be the principal at my son's school. A very small world.
Yes,
and he's doing well, right?
He's doing great.
All right. Now, do you look at his plate and see what he's eating and say, Dad, you should eat a little more of these?
Yeah, but I think just like everyone else, you don't want to believe that your kids know more about something than you do. So sometimes they'll come home and say, Kirsten, did you know what I saw on Dr. Oz? And I'm like, I've been telling you that for 6 months.
So I would guess that this is really the core of what you both do in nutrition, because you're only as good as what you eat, right? Is that basically what it comes down to?
Well, I might be biased because I am a nutritionist, but yes, I mean, having a good, proper diet puts us at the best possible advantage to being as healthy as possible. So definitely important.
And everybody, all that stuff that your mom used to say to you, eat your vegetables, and all that kind of stuff. It's boring, but it's true, right?
Kind of true.
So what's the path for a nutritionist? What's your education and what specialty, how do you specialize?
So I'm registered holistic nutritionist. There's 2 private colleges here in Vancouver. So it's a very specialized nutrition program meant for practicing nutrition. A lot of nutritionists do practice alongside naturopaths. And kind of the difference is that we don't have to practice within the Canada Food Guide, so we have a little bit more leeway with how we work with people.
What does that mean? You don't have to work within the Canada Food Guide?
The Canada Food Guide is sort of through Health Canada.
Which is kind of, they're saying it's old, right? It hasn't been up.
And even
they did an update on it, but it wasn't really significant, right?
And it's coming up for update again. So it just gives us a little bit more leeway to specialize and individualize programs for people. And then also as a holistic nutritionist, we take into consideration other lifestyle things like supplementation, lifestyle, sleep hygiene, all of those other things that do make a big difference to overall health as well.
All right. So on today's show, we're going to talk about digestion, skin health and aging of the skin. I'm sure a lot of people are interested in that. Hormones, especially, is it for both sexes now, or is it still mostly for women?
I'd say it's important for both.
Okay.
Definitely.
And then cognitive health and memory. If I can remember the last one, we'll get to that. All right. So let's dive into to the digestion. I'm sure this is something that you see as a common theme in your practice, right?
I would say that probably for both Kirsten and I, digestion, digestive issues is probably the number one thing that we actually treat. It's something that most people don't love to talk about. It's uncomfortable, but it's really it's one of the most common issues today.
And we're really used to talking about it.
Absolutely.
So it's totally fine.
So what would some of the things be, like reflux and not being able to digest your food, or irritable bowel, all those sorts of things?
Absolutely,
All
yeah.
of the above.
Acid reflux, heartburn, gas, bloating, indigestion, constipation, loose stools, and then, we get into IBS and other diagnosed digestive conditions like Crohn's and colitis as well. So there's a really, really broad spectrum. Some people are dealing with something that is, certainly a more serious digestive condition. But one of the really important things is, as we age, we have this sort of natural decline in our digestive function. So that becomes really, really important when we're thinking about nutrition as we age.
So the quality of the food. So I recently went to the doctor for a checkup, and of course I'm getting older, and it's like, you've put on some weight since the last time, and I say, well, I eat healthy food, and she says, well, it's quantity and quality, right? So obviously you're eating good quality food. Maybe you're eating a little too much of it. So is that do people come to you for weight issues even?
Absolutely. And for me, I always focus on quality first and then tweak quantity second. Yeah. But yeah, weight is a huge part of what we do as well.
Because that affects blood pressure and cholesterol and blood sugar and all that stuff, right?
But one thing that people may not realize is that ineffective digestion actually can prevent us from losing weight easily, because we're not able to absorb nutrients as effectively. So that
can you give me an example of that?
Well, if we're not able to, say, digest fat very well, then our body's not able to burn its own fat stores very well. So digestion can be a huge underlying factor in weight as well.
So is that where maybe supplements come in, or is it just changing the diet?
Sometimes diet alone, and sometimes supplementation can help as well. Like a digestive enzyme is something that we recommend a lot for people as they get older, because their digestive enzymes and stomach acid naturally decrease with age.
So I would suggest that most people want to change their diet last. Because I just know this because, I had the checkup and the doctor's like, well, you could lose 5 pounds or whatever. It's just like, well, I like what I eat. I like how much I eat. I don't want to be hungry and all those sorts of things.
We always joke that I'm the most unpopular person at the clinic.
Yeah.
But they like me later.
Yeah. And I mean, it's sad, maybe it's a good thing, but is that diet really is, it's the thing that we have the most control over. I think there's a huge misconception that eating a really healthy diet means that you're going to lose flavor and, lose all of the things that you really, really love. And that's just, from our perspective, just not the case.
And so give me a story of somebody who's come in and is feeling lethargic and they're overweight and they've cholesterol and blood sugar and all that has changed. And then you put them on this program and 6 months, a year later, how do they feel?
This is my poster child. I always talk about this person. Gentleman in his late 50s, really, really busy professional. And he was very, very overweight. And we worked a lot with digestion. And he ended up losing over 100 pounds, actually. Wow. And he's maintained that for a couple of years now. But even more significantly than that, all of his markers completely normal now. So all the cardiovascular markers, cholesterol, blood pressure, blood sugar, all of those things completely within a normal range.
That's great.
Yeah.
And how much did he have to change his life?
Quite significantly.
Yeah.
That's a fairly extreme case. But I actually think that people, once they make those changes, actually are surprised how little effort it takes once it kind of becomes your routine.
Does it become a bit addictive? Like once you start to see results, you kind of get motivated? Because the worst thing is to try something for 3 months and you bang your head against the wall and you go, well, I give up. I'm going back to watching TV and eating potato chips, right? So how do you keep people? Is that part of what you do? Is their cheerleader, hold their hand, all that kind of stuff?
That's a huge part, actually. Is we do act like people's cheerleaders a lot of the time, and I think for a lot of people, what keeps them motivated is feeling better. I got better energy, my digestion is moving better, I'm not dealing with chronic heartburn, I'm not popping Tums after every single meal. I'm sleeping better, I'm starting to see my body change, I'm losing some body fat and building muscle. I think that's what really sort of keeps people going, is just generally feeling well.
And that's the goal.
Ultimately, yes.
Yeah. And so what are the, can you give me, we're talking the first segment here about digestion, can we give us some free tips here? Top 3 things you can do?
Sure. One thing that's really easy to do is not to drink a lot of water when you're eating your meals.
Really?
Yeah.
My wife she drinks water all day and night. Like I always say to her, maybe you're drinking too much.
And some people, I think
So should you change it to wine?
Well, that's not an option. We're not against wine, but
not at breakfast and lunch, at least.
Oh, geez, well, there goes my diet. Okay.
But yeah, what drinking a lot of water during meals actually dilutes stomach acid and enzymes further. So it can compromise digestion. So what you want to do is have only small sips during meals, and then focus your big amounts of water outside of mealtime.
After? Like how soon after?
Like maybe half an hour before and half an hour after.
Okay.
And that just gives the stomach some time to start doing its work.
I have a friend of mine whose parents-in-law, the father-in-law, is a traditional Chinese, like a master. He lives in mainland China, and he's like the guru. People come from all over the country to see him. And he never drank cold water.
Never.
He's always warm water.
Warm water. And when you go to most restaurants, whether either Japanese or Chinese restaurants, they only ever serve you hot tea.
Yeah.
So it's one of those principles.
Or sake.
Or warm sake.
So that's number 1. Don't drink too much water with your meals.
Yep.
Anything else?
Number 2 is smoothies. That's the hugest thing for me, is because you're pre-digesting something outside of the body. So you're blending it up in the blender, and that conserves some energy from our own body. We do it outside of the body. And you can tailor smoothies to be low sugar if you have blood sugar issues, or low in fat if you can't digest fat very well. So really easy
or high in protein.
High in protein if you're active or whatever. So really easy to individualize and really easy to break down in the body.
And should you drink water with that?
No.
All right, and what's the third one?
I love apple cider vinegar.
Really?
Yeah. So
on your French fries? No, I'm joking.
No.
We're trying to get healthy foods here.
So having about a teaspoon of apple cider vinegar in a small amount of water about an hour, 45 minutes, an hour before a meal helps to boost stomach acid.
Really?
Yeah.
So what about those people that have too much acid? They have GERD or heartburn, all those things.
For some people, it's actually not a problem. And some people who have symptoms of heartburn actually have something called deregulated stomach acid, which actually stems from too little stomach acid.
Really?
Yeah.
So there's a big challenge with that the symptoms of having too much stomach acid and too little stomach acid are almost identical. So this is a case where a lot of people will go to their family doctor and they'll be like, I'm getting heartburn, I've got acid reflux. And the first thing that they're given is medication to lower their stomach acid without any evaluation, that's sort of been done on whether or not it's too high or too low. So it's a really, really tough one actually, because sometimes that's where medication can make the problem a little bit worse. And maybe, adjusting a couple things in your diet, trying something like apple cider vinegar, is a good place to start before you go right into medication.
And if you get a burning sensation, you have too much stomach acid. And then if you eat a little bit of yogurt after, it'll be all good.
Really?
Yeah, helps to buffer the acidity.
I've learned so much already. We're speaking with our professionals here from the Integrative Naturopathic Medical Center in Vancouver, Dr. Katie Leah and Kirsten McEwen. We'll continue our conversation next. I'm sure a lot of people are going to be interested in the next discussion, which is skin health and aging of the skin. We'll continue next on Boomer Life here on CL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.